Good evening, and thank you so much for joining us once again. I'm Phyllis Cortese, and this is Local Edition. Tonight, we welcome a wonderful nonprofit organization to the program, MCCA, Midwestern Connecticut Council on Alcoholism, and their president and CEO, Joe Sullivan. Welcome to the program, Joe.
Oh, thanks. Thanks for having me, Phyllis.
A pleasure to have you on board. Tell us, Joe, I know we've been speaking before we started the program. 32 years you've been with this organization.
Yeah, 32 years, yeah.
So obviously the organization's been serving the greater area for that many years.
Right,
We're
celebrating our 40th anniversary this year, 2012.
Wow,
and
40 years.
Yeah, and when I started, I think we had 12 employees, and I think our annual budget was around $250,000, and now we have 175 employees, and
wow.
Our annual budget's over $10 million, and we service more than 5,000 people a year.
That's amazing.
Through our various programs.
Does that say over the last 40 years that the need has grown, or that more people are seeking help?
You know, I think the need has grown to some extent, but I think it's also more people are seeking help, and there's a little less stigma now about getting help, and there's more resources available than there were 40 years ago,
right,
to deal with the problem.
Right.
And you know, thanks to the state of Connecticut and some of the other funding sources, the United Way, there's a greater recognition and greater resources to help serve people. It's a huge, huge problem.
And stigma for years was an issue probably, and a deterrent to help people, really. Do you think because over the years so many celebrities would come forward and would publicly say, hey, I got a problem and I want to talk about it, and I want to talk about it so that you could get help too, because I got help and I'm doing great. Do you find that helps? I
do. It's helped. That, again, is a two-edged sword, though.
Yeah.
It's helped and it's hurt. Where it's helped is particularly when celebrities or people of prominence get into recovery and continue with their recovery and do well in recovery. Then there's a real positive message. Unfortunately, some high-profile celebrities get help, and for whatever reason it doesn't take, and they're back out there, and then I think it maybe furthers the stigma a little bit, and kind of undermines. More people who get help get better than don't. But I don't think that message is always conveyed so well, you know.
Consistent, especially when they end up in the headlines the next time. Let's go back a little bit. Tell us about how the organization MCCA got its start 40 years ago. Well,
you know, in the late 60s and early 70s, there was a big push to deal with drug addiction, particularly opiate addiction, in the Vietnam era. And there was a lot of opiates coming into the country. A lot of soldiers got addicted to heroin in Vietnam. And we learned at that point that it wasn't always necessarily addicting. A lot of soldiers used heroin, I'll say, recreationally, and didn't get addicted. But some came home addicted, and then a lot of heroin was coming into the country. So the federal government put a lot of money into opiate treatment programs and got them started. That was, as I say, about 40 years ago. The alcoholism community said, hey, hold on a second. You're not doing anything for alcoholism. And alcoholism and alcohol abuse is a far bigger problem than opiate abuse. And if you're going to do that, which you should for opiate treatment, you need to do something about alcoholism.
Right.
And that's how MCCA got started. Got a small grant from the state of Connecticut, about $25,000, to do public awareness and public education. And then over the years got some money from the state to start some rehab programs. Years ago, Danbury Hospital had a detoxification unit, which was actually started by MCCA with some money it got from the state, and then contracted with the hospital to establish a detox there. it doesn't have one any longer. Actually, MCCA has a detox program now.
Okay, so back then, did you actually have a physical facility? Did you have a building, or were you a program basically that didn't really have a home?
Well, no, there was a little office on the corner of Main Street and Crosby Street, as I understand it. I was on, when I got the job, it was at lower end of Main Street, little small office that, you know, 3 or 4 offices, I guess. We had, as I said, 11 people there.
Right.
And in those days, our residential treatment was over on, it's still called McDonough House, but it was over on McDermott Street in an old-fashioned nursing home type facility. So things have changed a lot. So.
Yeah, over 40 years.
Yeah.
How many different facilities does MCCA operate?
Well, we have, we go as far east as Waterbury. We have a large outpatient clinic in Waterbury. We have a large outpatient clinic here in Danbury. We have actually 3 locations here in Danbury, Ridgeberry Road, and then 2 buildings on Hospital Avenue. We have an outpatient clinic in Ridgefield. We have an outpatient clinic in New Milford, and also one in Torrington. And we also have a long-term care center for chronic people who have chronic relapsers that end up needing long-term care at Trinity Glen in Sharon, Connecticut. That's a 50-bed facility.
Wow.
And then the 10 is soon going to be a 12-bed detox on 38 Old Ridgeberry Road here in Danbury, and a 22-bed residential treatment center there also with the on the lower level of Ridgeberry Road. So we have one of the best, what they call connect to care. What they found over the years is the people who do best are people who stay in treatment, stay connected to care for about 6 months. What the research shows, that's the single best predictor of a positive treatment outcome. Staying connected to care for 6 months. Interestingly, the people who don't stay connected for less than, the ones who stay connected for less than 6 months don't do well, and the ones who stay connected for more than 6 months don't do that much better than those that stay for 6 months.
Well,
so we work hard at keeping, somebody may enter our detox program, and then we work hard at connecting them to either an outpatient clinic or longer-term residential treatment. If they go to longer-term residential, then we try to help them step down into outpatient and just stay connected. And always we support and encourage involvement in the self-help programs. Narcotics Anonymous, Alcoholics Anonymous, Cocaine Anonymous, and those programs. They're vital for the long-term success and recovery.
How does helping the family or loved ones or friends, I mean, do you offer services for your clients' support family to help them help your clients at home?
We're making a major effort actually in our 40th anniversary year. That's one of our big themes or our big pushes, is to do more to work with families. One of the things we rolled out about 8 months ago is a program called How to Cope, and it's directed for family members who have to cope with somebody with an addictive disorder in the family who may or may not be in treatment. And it's a 7-session program that helps them develop skills and understanding and self-awareness of how they can better cope with the situation for their own sanity and their own well-being. We just, several of us attended a presentation today. There's a new law in Connecticut. There's a big risk for people with opiate addiction that get into.
Just let's define opiate. Are those prescription drugs?
Well, it's heroin, and also the prescription OxyContin, Percocet, those kinds of things, which is a huge problem in this area in particular. And a lot of young people, I'm talking 20s, 18 to 20 to 25 to 30, getting hooked on painkillers. And
for a legitimate medical problem?
Well, maybe that, or they just get a hold of it. There's a lot of overprescription, and then there's a lot of excess drugs that people keep in their medicine cabinets. They don't use them. I was telling somebody I had a hip replacement surgery about 5 years ago, and they gave me a bunch of OxyContin that I didn't use, and I used a couple, and I still have the pills. I have to dispose of them.
Right.
Later this month, I think it's the last Saturday in the month, is a disposal day where people can take their prescriptions and dispose them at the police department.
Right.
Yeah.
Because you're not supposed to put them down the drain or the
right.
toilet.
They do. They can contaminate water.
Right.
There's a lot of problems with
Yeah.
it, and you shouldn't leave it around. We know that kids, they have medicine cabinet parties. They get the drugs out of their family medicine cabinet.
Really?
And they
So
get high
teenagers
on
who are
them.
still or young
Yeah,
adults who are living home
They
with
find
mom.
them. They're unused. They're just excess.
Wow.
And they have parties and use them. And so that's very dangerous and very risky.
Yeah.
So we want to encourage people to dispose of the unused prescription medications,
Right.
particularly the opiate-based stuff that can be abused so readily. So,
Wow. Amazing.
So-
but then we were talking a little bit about the family, about bringing the family in and,
Oh,
and
yeah, and
teaching them new skills.
one of the
and
things we're going to start
hoping-
teaching family is that young people, or not young people, people who are treated for opiate addiction are actually, if they reuse, at risk of an overdose and an overdose fatality. Because one of the things that characterizes a lot of drug use is a thing called tolerance. And the more you use, the greater your tolerance. People get help and they stop using, and when they're not always aware that if they use the same amount that they used 6 months ago, that was fine, well, not fine, but was
right.
worked, and
Yeah.
could be so much that it could kill them now because their tolerance
went down.
went down.
Yeah.
So we're going to start a training and awareness program for family members of opiate people with an opiate history, so that they would know what to do in the case of an overdose, so that
Right.
people don't have to die. An interesting statistic I heard at this presentation, actually just today, is that more people die of opiate overdose than motor vehicle accidents, gunshot wounds,
Wow.
and one other things combined. It's a big cause of accidental death
Wow.
in the state
Taking
of
too
Connecticut.
much, or maybe mixing it with something, so mixing an
Just
opiate
using,
with
just
alcohol,
using.
or
Well, that's a
combining.
risk. Yeah, combining can be a risk.
Yeah.
But just simply using it. Somebody was using, whatever quantity. Maybe had a five bag a day heroin habit. Come into treatment, get detoxed, get clean and sober for 6 months, and then use the same amount that they might have used on another event. Would probably kill them.
Wow.
Because they have no tolerance anymore. Their tolerance has declined. And we're trying to do a better job in our treatment programs to make sure that people with history of opiate abuse understand their risk.
Yeah.
And we want to get the message across that they're worthwhile. They don't need to die. We don't want people to die.
Yeah.
They're good people that deserve to survive,
What do you think that the abuse stems from? Psychological issues or it's like what came first?
That's always the question,
horns, like,
and always the debate, and what comes first,
Yeah.
And we try to avoid that and just stay out of that. And it doesn't matter. There's certain treatment approaches that work. We do, by the way, have in all of our outpatient clinics are also licensed mental health clinics.
Okay.
And we started with that because the recognition that a lot of people that have what the professionals call co-occurring disorders, mental illness and a substance use disorder. And you have to treat them both simultaneously. Treat the person for whatever their issues are, but treat the person, be person-centered.
Yeah.
And then deal with, if they have mental health issues, deal with those. If they have addiction issues, deal with those, but deal with them in simultaneously and in the same context,
And there could be
improved lifestyle, really.
in looking at that philosophy of dealing, the person, if there are other extenuating needs or issues, would you go outside of the organization to try to bridge a gap and provide services that maybe MCCA does not provide?
Oh, absolutely. Yeah, we refer a lot. A lot of our women get referred to the Women's Center, for example.
Right.
A lot of you know, we work hard at having every people who go through our programs. We collaborate with the AIDS folks to have them tested for HIV,
Right.
and things like that. But also, we've developed a lot of support services ourselves. Now we have a very wonderful housing program called Sunrise Terrace that is supportive housing. Actually, 8 beautiful townhouses in Danbury that people who go through our various programs can then step down into a supportive housing while they get back on their feet, get a job, stay in recovery, and have affordable housing in
That's fantastic.
Danbury.
Yeah.
We have case managers and recovery case managers / recovery coaches to help people and hook them to other services,
Right.
financial resources, other social services that they need. That's their job.
Is that temporary housing until they get back on their feet? Or are
It's called transitional housing for where they stay for up to a year.
Right, right. Wonderful.
Yeah.
What are you looking at the demographics? Is it soup to nuts? Is it young to old, or the typical? Not that there's a typical. Every person is different and unique. But if you were to look at a typical demographic of the client that you serve, more men than women, mixture of both, obviously, or is it
About 60% of our admissions are male, 40% are female. I think the males, a higher percentage of the men are referred through the criminal justice system than the women, because they do things that bring them in conflict with the law more frequently than the women do.
Yeah.
So it's about 60-40. The age range runs the gamut. We do have a specialized program for seniors, several specialized programs for seniors. We're the only, MCCA's McDonough House is the only residential treatment center that has a special program for seniors. And we've had people as old as 80, in their 80s,
That's
come
amazing.
into treatment there.
Well, especially with the baby boomer population aging now,
Yeah.
you know, the majority of the population is going to be older.
Right. And they talked about mixing drugs and alcohol and stuff.
Yeah.
Even just prescription drugs
Sure.
in combination with a few drinks can, at a younger age, might not have been a problem, but in their later years, again, tolerance is decreased
Right.
and so forth. So a couple of 2 or 3 drinks might have been fine when somebody was in their 50s. When they're in their 70s, it might have a bigger impact
Yeah.
and cause more dysfunction. So, but most of the people coming in really have a longer history of alcoholism.
Right.
That come into treatment. Some of the seniors
Right.
that come
Yeah.
in. So we do a lot. Danbury, as you know, is a very diverse city in
Yes.
terms of a lot of Latinos and stuff, and we do have a specialized program for Latinos, Latino outreach, and we have in our outpatient clinic here in Danbury and in Waterbury, we have outpatient treatment that is conducted in Spanish. So we're very, we have some wonderful Spanish staff that do a great job, and we're very pleased and excited about that.
Yeah, well, that's good to reach out to the diverse population.
Right.
Let's talk a little bit about addictions with youth and kids. What are you seeing statistically? How young are teens and kids being exposed to alcohol and drugs today?
Oh, I mean, we see it at a very young age. We have a therapeutic group home in Bethel, and we used to run a residential treatment program in Norwalk that has closed up for lack of use because the state Department of Children and Families didn't want to refer people into residential, wanted to use outpatient more readily. But we're seeing kids as young, 11, 12, 13 years old coming into treatment.
Really?
So use starting at a young, certainly
Now,
a young
are they
age.
exposed at home, or are they being exposed on the streets?
In
or
the streets,
11,
in the community.
That's
yeah.
scary.
Yeah.
11.
Yeah. But we see, when we were running the residential treatment program in Norwalk, the girls that were coming in there were 13 to 16. So if you're coming into treatment at 13 or 14 years old, into residential treatment, you have started use a couple years earlier. So different drugs, progression is more rapid with certain, types of drugs. But, the kids you see, it's typically they start with marijuana and alcohol. So we've seen over the years with young people as well as older people that the drugs, cocaine at one time was a big problem. The big problem now is opiates. And alcohol is always the old steady, is always the leading drug of abuse that we admit people for. Yeah.
Especially mom and dad sometimes will have it open and available at home.
We are working on, we have a grant or a contract from the state of Connecticut to work on what's called the Strategic Prevention Initiative, and our focus with that is to reduce underage drinking in the city of Danbury. And we're working with the Stand Together, Make a Difference, which is the Danbury Local Prevention Council, and we work hard with them. We're partnering with them on that effort to reduce underage drinking. And I think next summer, one of my priorities is to have an impact on young people drinking while boating on Candlewood Lake. It's a huge problem, and we're seeing in some of the New York communities, particularly on Long Island, that they're really focusing on drunk boating. We haven't done much in this area about that, and I think we need to, before there was a tragedy a couple years ago.
Did they determine it was from?
It was alcohol related.
Oh, really?
Yeah. And
the
but
person
I think
who died was drinking?
No, there was a couple
someone
fishermen, and a boater was speeding and was drunk and hit at night the fisherman's boat and killed the two people in that boat. And another person in his own boat.
Wow.
So and young people in particular. I go out boating on Candlewood Lake and I see it, and you see a boatload of young kids with, coolers full of beer, and nobody's doing anything about it. And I think we need to really focus on that.
That's interesting. Never would even think about that. I mean, there must be license. You must have to have a license to drive a boat.
You do, absolutely.
Even if it's on a lake.
Yeah, you have to be licensed.
Nobody's policing.
Nobody's policing
area,
the alcohol, and I think that needs to become a priority. And it has, as I say, it has in the New York communities on Long Island, on Long Island Sound. It really, but I think Connecticut's got a ways to go, and that's going to be one of our priorities next summer, to try to focus on that.
Yeah, interesting. What do you see as one of your biggest challenges in MCCA?
Well, our two biggest challenges are, one is recruiting enough staff, qualified, credentialed, licensed. In this environment, you have to be licensed or certified.
You can't have volunteers.
No, you
in
all
any
the
capacity.
we use volunteers in certain capacities, but to be a counselor or a therapist, you have to be licensed or certified in the state of Connecticut. And a lot of people entered this field like when I did, 30, 40 years ago, and we're getting to that retirement age. We need to replace them, because that's a challenge. And the other is this not in my backyard mindset. For some reason, people think, when people move to an area, they want to move to an area where there's good schools, where there's a good hospital. But people don't say, I want to go where there's a good treatment center. And yet, almost everybody knows somebody who is an alcoholic or has an addictive disorder.
Right.
And what do we want them to do? We don't want them to get help, or we want them to have to travel 1,000 miles to get help?
No, I don't know anyone who has those. So it's the NIMBY, not in my back. Or no, I wouldn't know anyone like that.
We want to have them. We want to have good treatment close to home. And I'm proud that MCCA has a reputation as being among the best, if not the best, provider of our type in the state. And I would think that communities would want us there, rather than not want us there.
Absolutely.
But sometimes what do they want? People think they're better off not in treatment, better off out there driving drunk and using drugs or something. No, we want them in treatment.
So
we want to encourage
services available
close to home.
Close, that's right.
But that's not always. So that's a challenge.
Well, you're in
and we
Ridgefield
fight that
too.
battle.
So is the Ridgefield community saying, no, there's no one
No,
who abuses
Ridgefield
drugs or
invited
alcohol
us in,
That's
and
fantastic.
they give us town space to operate
That's
the clinic
fantastic.
in. Yeah. Now there's an enlightened community.
There you go.
Yeah.
So looking at
Yeah.
the
And
demographics,
Danbury,
it's not
Danbury
necessarily
is
low
enlightened,
income.
has welcomed us
Yeah.
and supported us. We,
Yeah.
you know, we have a wonderful relationship with the city of Danbury and the mayor and so forth. But,
Right.
you know, it's not everywhere, and so we're trying to, you know, spread the word on that.
Yeah.
But that's a challenge,
Yeah.
and we work hard at overcoming that.
For we just have a few more minutes. A couple quick questions for clients who come in who don't have insurance, no ability to pay. You can see obviously they want help. They're asking for help. They need help. Can you help them?
We can help them. We
So-
absolutely
so
can help them.
so
We're fortunate that we have grants in most of our offices where we can offer service for free or little or little or no payment. We do like to have people pay something, given that they're not giving. They don't give away beer and wine and whiskey in the liquor stores or the bars, and given that even the drug dealers don't give it away once somebody's hooked,
That's
that
right.
they're paying for it. So
Yeah.
a little investment in one's recovery is good, but it's not
Absolutely.
payment is not an obstacle
Okay.
for somebody being able to be helped by MCCA.
Right. So if you're looking for help, you know that you need help, maybe you're afraid to reach out and ask for help, MCCA is there. You can answer questions on phone if you're a little bit apprehensive to come in and walk in the door. Is there a hotline or some place that, you know, people can call just to get some information?
Oh yeah, our our regular number, this 203-792-4515.
Okay.
They can always hook somebody with our admission staff, and they're happy to talk to them over the phone. Of course, we have our website, and we have. I'm told we're on Facebook now, so we can
good.
access.
Well, everybody's
you know,
on
I'm an old
Facebook.
man, so I'm not up to all that state of the
No,
art
but the
stuff.
organization,
the
is
organization
out
is.
there reaching everyone in the community.
Yes.
Let's just touch on the website a little bit. It's MCCAonline.com, and that's Midwestern Connecticut Council on Alcoholism and Drug Abuse and Mental Health Issues. You guys do it all.
And gambling, actually, too. Problem
I was just going to
gambling.
bring that up. So
Yeah.
it's all types of addictions.
We have a specialized program for gamblers.
What about shoppers?
No, we haven't. Not there yet. Not there yet.
There's-
Is there a market there? Maybe we'll.
I know some people who can't get out of the stores. They don't have
Yeah,
money,
that's
but
true.
they can't stop shopping.
Yeah, there are and internet
Yeah.
addiction too.
Yes.
Is we're not doing anything with
Yeah,
that.
but I mean, addictive
but-
behavior it could be anything. Overeating, it could be over shopping or
Yeah.
gambling.
Yep.
So it's not only drugs and alcohol.
Right, but we're
gonna
problem
focus.
gambling and the alcohol and drug abuse. I'm sure in the next couple of years we'll be doing something in nicotine addiction, and we've kind of dabbled in that, and for a variety of reasons haven't put a program together. But I would expect within the next couple of years we'll be doing programs for
Fantastic.
nicotine
Yeah.
addiction.
Absolutely. Well, thank you so much for joining us.
Phil, it's my pleasure.
Your
Thanks
first
for
40
having me.
years, Joe.
Yeah, right.
So,
right.
onward to another 40
Right,
years
well.
and serving Western Connecticut with
Thank you.
MCCA, Midwestern Connecticut Council on Alcoholism. For any questions, just to check them out and find out about their programs and services, go online again with MCCAonline.com. Wonderful nonprofit organization, and they do tremendous work here in the community. Thanks, Joe, for your first 40.
Thank you.
And thank you so much for joining us. I'm Phyllis Cortese, once again for Local Edition, and we thank you for joining us. Bye-bye.